the patient are recovered from after acute or subclinical course, and the course is very ominous and with hepatitis C viral infection. The second type of hepatotropic viral infection or serum called hepatitis B is hepatitis B, or called serum hepatitis. Serum hepatitis, this is, as I say, is the only double-stranded DNA viral infection virus of hepatini group transmitted through parenteral route, blood, semen, and saliva, and the parenteral transmission, blood transfusion, blood products, plasma or platelet or so on, dialysis, needle stick accident among health care workers, IV drug abusers, and sexual contacts. The inoculation in breaks of the skin and mucous membrane, vertical transmission from the infected mother to a child. Incubation period is longer than hepatitis A. It is about 6 to 8 weeks. The outcome or the presentation of hepatitis B virus. Number one, acute hepatitis with recovery, like hepatitis A. Complete recovery. Non-progressive chronic hepatitis. Non-progressive chronic hepatitis, or called subclinical hepatitis. Progressive chronic disease ending in cirrhosis. 5%, about 5% of hepatitis B virus progress to chronic disease and cirrhosis. Fulminant hepatitis with massive liver necrosis in pregnant women or in certain immune compromised people, or it can be presented as an asymptomatic healthy carrier or inactive carrier. The viral genome or the viral hepatitis B virus is composed of surface antigen, hepatitis B surface antigen, like so they are called surface antigen, or called on the surface of the virus, of the structure of the virus. Internal to it is the hepatitis B C antigen or core antigen, and hepatitis B E antigen that are secreted into the blood and indicate active viral replication. DNA is a double-stranded seen in the center of the viral structure with a DNA polymerase enzyme, important for reproduction or replication of the virus. And there is a certain protein called hepatitis BX protein that is important for viral replication and have important role in hepatitis B viral associated cancer or hepatocellular cancer, and hepatitis B is called hepatitis BX protein. So again, hepatitis surface antigen, hepatitis core antigen, and hepatitis E antigen. The anti-hepatitis BS antigen appear after acute disease from few weeks to several months and may persist for life and confer protection. Hepatitis E antigen, so hepatitis S, anti-hepatitis BS antigen, هذه مو anti يعني hepatitis BS antigen can be seen in acute stage, and antibodies will be formed against this surface antigen and confer protection. the hepatitis B antigen and hepatitis B viral DNA that is detected by PCR appear in the serum after the hepatitis S antigen and signify active viral replication, increase of the level of hepatitis B, E, and B DNA viruses, DNA. This indicate active viral replication. That is there is an active ongoing hepatitis B viral course. Persistence of hepatitis B antigen is an indication of progression to chronicity. Persistence of hepatitis B antigen, this is an indicator of progression to chronic hepatitis. The appearance of hepatitis B or anti-hepatitis B antibody indicate acute infection has peaked and on the wane. يعني تتضاءل on the wane. يعني presence of the anti-hepatitis B antibodies indicate that there is acute infection, and with the appearance of these antibodies that are peaked and the acute infection has disappeared. The host immune response is the main determinant of the outcome of the infection for any disease process. In hepatitis, hepatotropic virus or hepatitis B viral infection, the immune competency or immune response of the patient, this is the main determinant. So in immune suppressed people, like in HIV positive, like in pregnant women, like in patient taking corticosteroid, the outcome is determined by the immune response of these patients. Whereas patient with immune competent people, good immunity, the course is most commonly run into acute resolving and without passing into chronicity. The patient age and the time of infection is the best predictor of chronicity. The age of the patient, again, elderly people can develop also chronic infection. The younger the age at the time of hepatitis B infection, the younger the age, the higher the chance of chronic infection. Here, the younger the age or at the time of hepatitis B viral infection, so elderly people are determined as with lower immunity. Earlier exposure to the hepatitis B viral infection, they can pass as certain studies showed that they have higher chance to progress to chronic infection. Serum hepatitis can produces again acute hepatitis with complete recovery, acute hepatitis with complete recovery, like in hepatitis A virus, chronic non-progressive or subclinical hepatitis, or chronic disease ending in cirrhosis, fulminant hepatitis with massive liver necrosis, and asymptomatic carrier state. Carrier state, what is the carrier state? It's called healthy carrier or inactive carrier. Is the persistence of hepatitis B antigen. Hepatitis B antigen will be detected in the serum for 6 months and more after the initial detection. And the patient may be asymptomatic. من نقول asymptomatic asymptomatic نقصد asymptomatic, there is no increase or elevation of serum transaminases in serum hepatocellular enzymes ALT and AST, and the level of these enzymes are normal, and the patient have no or minimal inflammatory process or necrosis on liver biopsy, or even have normal histology. So the presence of hepatitis B is so the persistence of the hepatitis B S antigen, persistence of the hepatitis B S antigen, persistence of the hepatitis B S antigen and hepatitis B E antigen and hepatitis B viral DNA with anti-hepatitis B C antibodies indicate chronic replication and progression to liver disease. The fulminant hepatitis, severe necrosis of severe hepatocellular necrosis with it is called microcephaly and associated with severe hepatic damage. Fulminant acute hepatitis, or only small islets or few islets of hepatocytes are seen, and the most of the tissue biopsy is replaced by necrosis and necrotizing foci. This is a diagram showed you the courses or outcome of hepatitis B. Acute infection is in which 60 to 65% passes into the subclinical or non-progressive disease. 20 to 25% acute hepatitis with complete recovery. 5 to 10% healthy carrier with the presence of the anti-hepatitis B-E antibodies and the absence of hepatitis B-E antigen, low level or undetected level of hepatitis B viral DNA by PCR, and repeatedly there is normal ALT or hepatocellular enzyme level with normal liver biopsy. And about or less than 5% passes into persistent infection, that is chronic hepatitis. Many of them are recovered after persistent infection, and a percentage about 10 to 33 passes into chronic hepatitis, in which there is development of cirrhosis and cirrhosis after consequences of liver failure. The patient will die, or cirrhosis can be a focus for hepatocellular carcinoma. This is the complete recovery, and here the chronic disease. The complete recovery, in which there is incubation period, the serum transaminases are elevated with the development of jaundice and symptoms in the acute disease. The serum markers are hepatitis B-E antigen positive, hepatitis B viral DNA positive, and hepatitis B-S antigens are positive. These are seen in the blood, and detected DNA is detected by PCR. After that, there will be recovery, and by 4 to 20 weeks, the symptoms will be resolved, and the immunity will develop by IgG, IgM, anti-hepatitis C antibodies, and anti-hepatitis B, E antibodies, reaching to the peak and then decline, and the IgG anti-hepatitis BS and IgG anti-hepatitis B C will be started later, months later, and this is the state of convalescence and recovery. شفاء أو نقاهة. The chronic disease. In the chronic disease, there will be persistence of the serum markers, including hepatitis B E antigen, hepatitis B viral DNA, and hepatitis B surface antigen. They will be persist for a long time, and the serum markers are still elevated, and serum enzymes, and no more or weak IgG or lifelong immunity months or later or years. In the development of carrier state, there will be absence of hepatitis B E antigen, absence of this antigen, and the presence of anti-hepatitis B E anti-hepatitis B E antibody, low level or undetected level of hepatitis B viral DNA, and normal liver enzymes. This is the carrier state. Liver biopsy also. Hepatitis C virus. طلاب وياي أكو سؤال لحد الآن؟ طلاب أكو سلايد أعيده؟ طلاب؟
دكتورة بس سؤال، السلايد مال الكارير ستيت ممكن يعادل للاي جي ام، يعني الليفل مال السيرم انديكيتور؟
يس. الكارير ستيت شلون نقول عليه هذا كارير ستيت؟ الكرونيسيتي هسه هذا الاكيوت ديزيز. هيباتيتس بي اي انتيجين بوزيتيف، hepatitis B viral DNA positive by PCR, and hepatitis BS antigen positive, detected for short period, and they will be wane or disappear after the disappearance of the symptoms, and there will be formation of IgG antibodies to C and S and IgG, IgM and IgG. The chronic state, there will be persistence of these markers, serum markers, hepatitis B E antigen, This will be persist. بالcarrier state هذا الانتيجين is absent. Antigen here is absent, and the presence of hepatitis B E antibody. Presence of hepatitis B E antibody. Also, there is a production of يعني undetectable or normal level of the hepatitis B DNA by PCR.
دكتورة، شنو اللي يخلي الهيباتيتس يصير كرونيك؟
شنو اللي يخلي الهيباتيتس يصير كرونيك؟ قلنا احنا الكورس is determined by the health status, by the immune status of the host.
يعني دكتورة، إذا immunity قوي ما يصير قوي، يعني immunity مضبوط ما يصير بيها كرونيك، بس إذا immunity مو مضبوط يصير بيها كرونيك.
Yes, regarding hepatitis B virus, about 60 to 65% they are بين subclinical وال هذا شو اسمه this is the subclinical اللي هو non-progressive، يعني يصير subclinical without passing to chronicity or acute like تقريبا 20 to 25 مثل الهيباتيتس A, and 60 to 65 they are subclinical. Only 5% or less than 5% they passes into chronic hepatitis or persistent infection. The immune system is very important determinant of the hepatitis B virus outcome. وشافوا earlier exposure to the virus, the earlier the age, كل ما يكون earlier or younger, they have higher chance to pass to chronicity. Regarding hepatitis C virus, this is called post-transfusion hepatitis. هذا هو الأخطر. This is this type of viral infection have about 85% of these hepatitis of this type of hepatitis will passes into chronicity, will passes into chronic hepatitis. And increased risk of cirrhosis and hepatocellular carcinoma. It is a main cause of liver disease. About 170 million people are affected worldwide. It is single-stranded RNA, IV drug abusers, multiple sex partners, surgery, health worker. هذه اللي هي parenteral transmission, through blood transfusion, through blood product, surgery, dental procedures, infected needle stick, and multiple contact with hepatitis C virus infected people, and medical and health care and dental field, and vertical transmission from infected women to children. Hepatitis C virus has a high rate of infection, has high rate of progression to chronicity and eventual cirrhosis and progressive disease and hepatocellular carcinoma. So about 85 or more than 85% are passes into chronic hepatitis. 80% have developed stable disease, and as أقول لكم شنو الفرق بين stable و unstable. 20% passes to cirrhosis, and the complication even either death from hepatic failure and systemic failure of cirrhosis and hepatocellular carcinoma complication. Fulminant hepatitis is rare. So hepatitis C, it is less common than B, and it is less dangerous in the acute phase, and more likely to go into or to passes into chronic disease than hepatitis B, and closely linked to hepatoma than hepatitis B virus. Hepatoma هنا هذه hepatocellular carcinoma. hepatoma هو الاسم الآخر للهيباتوسيلولار carcinoma, primary hepatocellular cancer. Acute hepatitis C viral infection is asymptomatic in 85%. It is asymptomatic in 85% of the cases and is easily missed. Hepatitis RNA, cRNA is detected 1 to 3 weeks in the serum with the elevation of hepatocellular enzymes, serum transaminases, and no lifelong immunity can be conferred from this disease. Persistent infection is the hallmark of hepatitis C viral infection, happens in up to 90% of the cases with subclinical or asymptomatic acute or acute infection or symptomatic acute infection with increased risk of hepatocellular carcinoma. So persistent infection, that is still detection of the hepatitis E antigen and hepatitis detection. Still there is detection of the viral antigens within the serum for more than 6 months. Cirrhosis occur in 1/3 of the cases, and the virus will use multiple mechanisms to resist the host antiviral immunity. In the chronic hepatitis C viral infection, the circulating hepatitis C viral RNA persists 90% in 90% of the patients, despite the presence of neutralizing antibodies. The test for hepatitis C viral RNA in the blood by PCR must be done to confirm the diagnosis of chronic infection. RNA detection by PCR for long time indicate passing into chronic infection. The characteristic of the disease of persistent infection, there is an episodic elevation of the serum aminotransferase or transaminases separated by period of normal or near normal enzyme level. So episodic attacks of elevation of serum hepatocellular enzymes. Any patient with positive serum hepatitis cRNA need treatment and follow-up, even if he has a normal serum level enzyme. Hepatitis C viral DNA is the important indicator for chronic disease. The improvement in the treatment of hepatitis C viral infection from the development of the drug targeted the viral proteases, RNA polymerase, and NS5A protein, which are required for viral replication. So drugs against these viral antigens, enzymes, viral protease, RNA polymerase, and NS5A protein that are important for viral replication. A combination of therapy is also effective, and the aim is to eradicate the hepatitis C viral RNA to become undetected in the blood 6 months after stopping the treatment. Viral hepatitis, whether A, B, C, or even other type, nodularity or fatty change or micronodular cirrhosis is a feature. Acute viral hepatitis, here prominence of infiltration by inflammatory cells, lymphocytes, spilling in between the hepatocellular trabeculae. The pointer is pointed toward apoptotic body or Castleman body. Spilling over, disruption of the limiting plate is feature of acute. Here, the process is acute. Infiltration by neutrophil is acute process with vascular congestion. Chronic viral hepatitis, lymphoid aggregate with fatty change. Lymphoid aggregate with fatty change is a feature of hepatitis C virus. Lymphoid aggregate is a feature of chronic hepatitis. Ground glass hepatocytes. Ground glass hepatocytes is a feature of hepatitis B S antigen within the cytoplasm of hepatitis B virus infection. And interface hepatitis. This is a spilling over of inflammatory cells from the portal tract to surround a group of hepatocytes in the periportal area called interface hepatitis. Castleman bodies or apoptotic bodies with cellular swelling and edema. Hepatitis D virus. This is also a parenterally infecting virus. It is dependent on hepatitis B virus for its life cycle. So it is presented either as co-infection at the same time by hepatitis B and D detected. DNA for both of them are detected, and the super infection of hepatitis B virus on a chronic case of hepatitis B virus. So acute co-infection associated with presence of IgM against D and hepatitis B C, indicating a new infection with hepatitis B virus, and super infection of hepatitis B virus on chronic hepatitis B virus. The presence of hepatitis B S antigen in the serum and anti-hepatitis B D antibodies, IgM and IgG, present for months, and it is eradicated or prevented by hepatitis B vaccination. The hepatitis B E antigen, this is another enterically transmitted or fecal-oral transmission, waterborne or like hepatitis A virus, infectious virus, with self-limiting disease, and mortality is mainly among pregnant women. Again, the clinico-pathological syndrome of viral hepatitis, either acute asymptomatic infection with recovery, acute asymptomatic infection with recovery, elevated serum, temporary elevation of serum transaminases with production of antiviral antibodies, and hepatitis A and B, especially in children. Acute symptomatic infection with recovery, acute symptomatic after the incubation period, which is of variable length in different viruses. Asymptomatic pre-icteric phase, that is before appearance of jaundice, or symptomatic icteric phase with presence of jaundice, and the convalescence state, النقاهة أو الشفاء. The peak infectivity happens during the last asymptomatic period and the earlier days of acute infection. Fulminant hepatic failure caused by viral hepatitis, mainly hepatitis B virus, only in 12% of the cases, and activation of the stem cells in the canal of Herring to give a prominent ductular reaction. Chronic hepatitis, the persistence of hepatic disease for long period after 6 months detection of the viral antigens within the serum of the patient for more than 6 months. The carrier state, hepatotropic virus infection. Chronic infection with hepatotropic viruses has no or subclinical evidence of liver disease, no elevation of the enzymes or